Test, test, test. 1, 2, test. I can increase the volume here too if I need to.
Yeah, can turn it up because we're running line. You're still running line. Yeah, they can crank the. Okay, talk now.
Test, test, test.
Okay.
Is it good?
You crank it up a little bit more.
A little bit.
Because we're both running line, or we're all running lines.
Test, test.
Yeah, that should be good.
Is that good?
Yeah, that's just working well.
Yeah.
Having one of those quiet talkers.
Test, test. Okay.
You're gonna be in the right, they're gonna all squeeze in.
We're gonna tell you to go over there.
I don't know.
I think that she wanted the 2 mayors to be closest to her and then
Yeah.
hospital people further.
You want me to have
We're just trying to figure out space. Spacing. Do you want everybody?
Yeah, so I thought the hospital next to go on to the far left and have the mayor.
There's no
closest to
step
Dr. Buchanan.
We only have one set of steps.
Do you want both the mayors on that side?
Yeah, we do.
Either way, when we get up there, we can see how our spacing is, if we're far enough apart. Keep going that way, yeah.
It's the fake need,
I'll go on
still
that
working
side
it
if
out.
you want.
That'll work. If the mayors wanna come over onto this side, that way we have enough space for all.
Do we?
Nothing's pretty sensitive.
Yes, you do need that on the.
Okay.
You're plugged into our mic.
Sorry, I was just asking because normally don't do that. Wow, okay. Is everybody good to go? All right, first of all, thank you for being here on such short notice. And I want to thank our healthcare providers for being here on such short notice, as well as both Mayor Buchanan and Mayor Jacobs. Really appreciate your support of our community and of the health department in this difficult time. As Knox County's public health officer, today I'm issuing a safer at home order. This order closes non-essential businesses and urges the public to stay home when at all possible, avoiding gathering in groups of 10 or more for non-essential purposes. Until further notice, all businesses not performing essential services have been ordered closed for 14 days, beginning 12:01 a.m. Tuesday, March 24th. A complete list of essential services can be found on our website. Businesses with questions can call 311. We understand the significant and in many cases devastating impact this will have on our families and local businesses. But we are hopeful this action, no matter how difficult it is, will help save lives. Now is the time for our community to come together and support each other in several ways. Staying home and protecting those most at risk of serious illness. Finding creative ways to get together and have social interactions. And also creative ways to support individuals and businesses most affected by this order. Consider ordering gift certificates to be used later or donating to a local nonprofit like the United Way's Knoxville, Knox County COVID-19 Response Fund. Health department staff and other medical personnel are committed to protecting the health of this community. We encourage you to continue to exercise patience with them as they work to sift through information and instructions. They have families themselves, and while the rest of us are social distancing, they are on the front lines. For that, I'm incredibly appreciative. Now I'll open it up for questions.
Dr. Buchanan, can you help us understand why now?
It's a great question, thank you. We talked about last week that we had seen an increase in cases in Knox County and in the region. Over the weekend, we had more cases in Knox County and more cases in those 15 counties that surround Knox County. So with the increasing number of cases, we felt like it was time to take a little more extreme public health measure of closing some non-essential services and encouraging people to stay home whenever possible.
Can you give examples of what are non-essential versus essential? How does this impact restaurants, shops, things like that?
So the details are found in the order and at the link. Some of the non-essential businesses we're asking to close are things like hair salons, tattoo parlors, other appearance-related services, massage that's not related to medical care. So again, the complete list can be found at the link, and then also some details in the order.
Can you explain how the county will be able to enforce this order and the steps to do that?
Sure, it's a great question. We are relying on the folks in these businesses to close their businesses under this order. I think everybody knows how serious this is, how serious COVID-19 is, and I'm trusting our local businesses to do the best thing for our community and follow this order and close.
Dr. Buchanan, we talked when we had those first initial cases. The first case was someone who was traveling and was isolated at home. Second case, someone who wasn't actually in Knox County. Some of the new cases, do you have any details can you give about whether these are community spread, whether these are hospitalizations that people are requiring advanced medical care?
So what I can say is that most of the cases that we have are not hospitalized. And again, I also want to say that we'll be making more information available about our cases on a regular basis on our website. That's not up yet, but it will be up soon. Also, what I can say is that at this point, we do have community spread. In Knox County, not everybody has a travel history, not everybody has a connection to another COVID-19 case. So that by definition is community spread. And these efforts are designed to flatten that curve, slow down the increase rate of cases so that our friends in the medical community can weather this storm a little more favorably. It's still going to stretch them, it's still going to be a real challenge, but it's going to slow the rise of those cases, and they don't have that sharp increase. Really will help them protect their staff, remain viable, and weather this storm a little more positively.
Can you help us understand what community spread is? Again, you touched on it there, but just for people who
Sure, that's a great question. So community spread is spread that happens in Knox County. So somebody who hasn't traveled to a place where there's ongoing transmission, somebody who hasn't been in close contact to a confirmed positive COVID-19 case and gets COVID-19, that person is considered to have caught it here in the community from some other source. They obviously had an exposure, they just didn't know they had an exposure. So it's what we have with flu every year. We have community spread of flu every year. COVID-19 is moving into that, just with a little, again, we've talked about the fact that we don't have immunity to this disease. It's the first time humans are seeing this particular virus. And so that makes us all more likely to get sick if we get exposed.
This may be a question for some of the folks on the stage as well, but obviously Knoxville does have community spread. It doesn't have the inundation that New York or Seattle or Nashville or all these other bigger metropolitan areas have had. Can you discuss, and maybe they can discuss in detail, what some of the things they're doing to proactively prepare staff and medical providers and people who are going to be in the trenches, if they're not now, which they are, but they will even more so in the next week or 2 weeks?
They don't, somebody can step over to the mic and speak to that if they'd like.
Thank you.
Thanks, Martha. I'm Dr. Mark Brown, Chief Medical Officer at Covenant Health. I'm working with all of our colleagues here across the community and other administrative and clinical leaders very closely. We're communicating almost on a daily basis, working with national suppliers to make sure we have the appropriate PPE, the personal protective equipment, trying to be as proactive as we can in getting all the necessary supplies in case we do have a surge. Fortunately, we have not had that yet, but we all are communicating with all of our staffs, our clinical staffs, our medical staffs on a daily basis, if not more frequently, as well as coordinating with Martha, the other public health individuals across the community and across the counties, as well as our mayors.
Is there, I'm sorry.
Dr. B, can you repeat the questions when they're asked if the live stream folks came through?
Okay, thank you. And I'll add to that personal experience. I had to go have a medical test done last week, and I got asked questions about my travel and stuff when I went in. So the other thing they're doing to try to reduce spread of illness in their facilities is reducing the number of people that go into the facility.
Dr. B, can you talk about non-essential businesses closing? Can people still go out and walk their dogs? Can they still go to greenways? What precautions do people need to be taking outside of going to businesses?
Sure. So the question is, we're closing non-essential businesses. What can people still do? So we are encouraging people to get outside. They still need to follow those social distancing guidelines, trying to remain about 6 feet apart. Our city and county parks will remain open so people can go take a walk, can walk their dog, can get out and do other things. We want people to have some physical activity. We know how important physical activity is to our mental health, and asking people to stay home more than normal or not work and stay home can be a real challenge for some folks. So we do want people to continue as appropriate to get physical activity.
Steve said this, but how long will those closures last?
So the question is, how long will those closures last? This order is in place for 14 days, beginning midnight or 12:01 March 24th. So in 14 days, depending on the situation, the order will be lifted, or we would have to review an order if that's indicated.
This may be a question for some of our hospital leaders, but we've seen shortages of PPE especially. Are you guys experiencing having not enough masks or supplies for tests and things like that? And how are you addressing those?
So Keith Gray, Chief Medical Officer, UT Medical Center. We are trying to be good stewards of the resources that we do have, specifically PPE. We currently don't have shortages, but in anticipation of escalation or increased burden of disease on the community, we are putting policies and procedures in place to plan for, to upscale the amount of PPE that we do have. Part of that is preserving what we do have. So if you recall, I think it's been 72 hours ago now, we've stopped all non-essential procedures in the county. That was a collective decision by all of the health systems here. And what that does is preserve PPE. We're co-locating those patients that may or may not be at risk of COVID-19. That preserves PPE. So we're more on the preservation side at this point. Our supply chains, as you know, are at risk because a lot of those materials come from outside this country. And so we're just keeping a daily monitor of when that supply may come in, what is coming in, and also keeping an eye on stockpiles that may be available to our health systems.
So if I could summarize here, it sounds like at this point you're not encountering that problem, but you're preparing to make sure that you don't.
Right. We want to be, yes, that, to answer your question, yes. And we want to be on the front side of that. I think when we recognize that we are short, it's too late. And so we're preparing as if we're going to see an escalation of the burden of disease in our community.
When we talk about this kind of escalation, it also impacts ICU beds and ventilators. Do you believe we have enough of those? What efforts are being taken to convert?
Well, it's hard to know what enough is, but we do have a running tally, a daily tally of how many acute care beds, how many critical care beds, and how many ventilators are available. And again, by not doing non-essential procedures, by not doing non-essential visits and diagnostic tests, we create capacity within our system to be able to handle an escalation of the burden of disease in this community if needed.
Are you also looking at increasing capacity outside the current physical plants of the hospitals?
You want to speak to that?
Sure.
Yeah.
Yeah, sure. So the question was, are we looking at increasing capacity outside the physical plants of our hospitals? Our current surge plan in our community does not include off-site facilities, alternative sites for care. All of our hospitals have collectively decided to cancel elective surgeries. That helps them free up space and supplies to be able to care for folks who need to be cared for. Certainly, if that were to happen, we would do that together, but our current plan does not include alternative sites of care. One of the challenges with those sites of care is staffing. Hospitals need to continue to be staffed, and we believe the best care can be delivered by our hospitals with their staff. So we're hoping that the measures we're taking today will reduce the chance that we would need an alternative care site.
Dr. Buchanan, it's nice that the county is being progressive and getting out ahead of this to the best of their ability. Does it matter if neighboring counties aren't as progressive? Does that negatively impact the gains that we would be making locally if people in Blount County, not to pick on Blount County, but Blount County or Anderson County or any of these counties that also have people who are infected, aren't taking those same measures?
So the question is, first a statement, it's great that Knox County is taking this step. Second was, does it matter that the other counties around us are not taking similar steps? And I think as long as everybody follows the social distancing guidelines, and with the closure of some of our businesses and change how our restaurants are doing business, folks who come here from other counties are going to get their food to go and take it home. And they're not going to be able to do the shopping that they might have done otherwise. So that reduces the risk to the people who live and work in Knox County.
Is there anything else you can tell us about the new cases in Knox County?
At this time, I really don't have any more information regarding those cases. My staff is still actively investigating or looking into those cases.
So just so I understand, are you still at the point where you're trying to trace back where people may have gotten the cases from and doing that kind of epidemiological work?
We are still doing contact tracing with each positive. So the question was, are we still tracing back to try to find out where people got their exposure? We are still doing contact tracing with the folks that are testing positive and tracing back to notify also folks who might have been exposed to them during their period of infectivity before they went into isolation. We continue to place people who are positive in isolation and check on them daily to make sure they're staying in isolation.
Can you, I know you can't go into detail about the cases, but you said that there's some that were hospitalized. Do we have a number associated?
Actually, I said there are none that have been
Oh, I'm
hospitalized.
sorry, I thought you said some, I'm sorry. And, how would you characterize the, number of new cases that are coming in? Are we seeing a large growth in cases? Are we still seeing one or two a day as we have in recent?
So I think there are a couple of things contributing to the steady rise of cases that we've seen in the last week. One is, as we've talked about, all of our hospitals, not really the hospitals, but all of our medical providers are ramping up to be able to test. So people have more options for getting tested. Commercial labs have come online and they're able to provide testing. So opens up that window to more folks to be tested. Again, you need to be symptomatic with a fever, cough, or shortness of breath to have an indication for testing. And COVID-19, like every other test that's done in medicine, has indications for which you should do it. And our medical community follows those indications. But opening that opportunity for other people to get tested certainly is no surprise. It's shown us that we have more cases. We expect that to continue to rise steadily. We hope that it doesn't rise too sharply. And again, the measures we're doing today are really designed to help. You've heard me say it, flatten that curve so that our medical system can bear the burden of disease that we see.
People at home who say, I have a cough, I might have some of these symptoms, what should they do? I know that hasn't changed. But.
So if somebody is at home and they have a cough or sore throat or fever, they should do what they normally do. If it's something you would normally pick up the phone and call your doctor and get an appointment to be seen, pick up the phone and call your doctor and let them know what your symptoms are. If it's something that you wouldn't normally go see your doctor for, we'd encourage you to stay home until you feel better and not necessarily seek medical care if you don't need to. And definitely if you are only mildly ill, we really don't encourage you at all to go to the emergency room. If you need to go to the emergency room, if you're so sick that you need to go to the emergency room, we encourage you, if you have respiratory symptoms and fever, we would encourage you or someone to call ahead and let them know you're coming in so they can be prepared.
The safer at home order to kind of help prevent the spread, if it doesn't work, is there a next step beyond that we might see, and when might that go into place?
So the question is, the safer at home order, if it doesn't work to slow the spread, what's the next step? I think that decision will be made in concert with our leadership in the community. We are hopeful that the people in Knox County will heed this order and help protect themselves, help protect our community, and slow the spread of COVID-19. In addition to all the things we've talked about, social distancing and all those other things, one of the most important things we can all do is stay home if we're sick and avoid people who are sick. I know that's hard. Your family member is sick and you want to do something nice for them. There are lots of ways you can do that now with technology, or send them a card in the mail, or drop them off some food at the front door and let them know it's there. But avoid contact with people who are sick so that you can protect your own health and continue to do the things that you need to do.
I wonder if we might hear from the mayors a little bit on this new step, on your perspective on this, why you think it's a good idea, and what people in the community need to know.
This is something that we've all struggled with, because I think we realize that this is having, going forward, to have a huge, it's having huge economic impacts on our country. And people are going to be out of work, both because of the virus and also efforts to combat the virus. But Dr. Buchanan, I have the utmost confidence in her. And as she said, also in the people of Knox County and East Tennessee. Because in the end, that's who's going to make the decisions about their personal behavior. So like Dr. Buchanan says, I encourage people to follow these guidelines because they're the ones who control really what happens next as far as the spread of this illness. And it's something that we all do need to take very seriously. So, and then this is the start really of a long process, because we'll At some point, we'll beat COVID-19, and then we're going to have to deal with the economic impact of that. So as a community, we all need to be stronger and more together than we have ever been.
Well, on behalf of the city of Knoxville and the people in the city of Knoxville, I'm very grateful and fully supportive for this order coming from Dr. Buchanan and the health department. They've been doing yeoman's duty during this COVID-19 emergency, and I applaud their efforts and fully support them. This is a very difficult thing where we are having to make unprecedented decisions between people's lives and people's livelihoods. And while livelihoods are important, lives are even more important. And I strongly encourage everyone in the community to stay home if you can, to help protect our first responders and healthcare workers who are going to be on the front lines who cannot stay home. And that includes our people working at grocery stores, people who are driving the buses, people who are, maintain, our police and fire and child care, daycare workers who are giving priority to the people's children who are in those first responder roles. So if you stay home, it helps save lives and it helps protect and make it more manageable for the people in our medical community to save lives as well. So thank you. The city of Knoxville is fully supportive of this order, and we will do whatever we can to encourage the community to comply with it.
Dr. Buchanan, would you like to invite any of the other hospital representatives to make comments if they wish?
Sure. Gentlemen, would any of you like to make any further comments?
I have a further question that someone might be able to ask.
Okay.
A lot of people in the community wondering how they can help if they have disinfectant wipes or masks at home, or maybe even we've seen people trying to sew masks together. Is that something, how can people in the community help medical providers during this time?
So I'll repeat the question and somebody's coming over to answer it. The question is, how can people help medical providers during this time?
I can speak for Covenant, and I think all of us are doing some very similar things. I'll reiterate a little bit about what Martha said. The best thing you can do for healthcare workers is to follow this order and to do all the things that we've been talking about to help prevent the spread of this disease. The more we follow this order, the sooner we'll all be out of this. So I think that's first and foremost. But if people are looking for ways to help, I know that we're trying to do a lot of coordination centrally. So if you can call either the corporate office at any of our facilities, we can get you in touch with the right people. There's not a list of numbers or a list of people because there's a lot of different moving parts to all of our organizations. We certainly appreciate all the help the community can do, but there are certain standards, CDC standards, medical standards that we'll have to follow for some of these. So we appreciate the help, any help the community can give, but the best thing you can do is the social distancing and follow this order.
All right, I think we have time for one more question.
Well, for anybody tuning into the live feed, can you just repeat what the order is and kind of explain it again, if you don't mind?
Sure. So this order is called the Safer at Home Order. And basically it closes non-essential businesses and urges the public to stay home when at all possible, avoiding gatherings in groups of 10 or more for non-essential purposes. And there's a much more detail in the order itself, which will be sent out shortly.
Can I do one more? Semantically, what's the difference between safer at home and shelter at home? Is there any real?
So the question is, what's the difference between safer at home and shelter at home? Safer at home means we're just encouraging you to stay at home as much as possible. Shelter at home, actually, we ask you to stay inside and really not come out. Usually used for shorter term things, like if everybody remembers the train derailment, we did a shelter at home then. So it means a little stronger language. This, we really just want to really encourage people to comply with this order and stay at home whenever possible and avoiding going out for things other than non-essential travel.
All right, thank you guys very much.
Thank you.
Go ahead. Go ahead.
Thank you, sir.
Thank you again for all y'all are doing.
Sounds good.
Thank you.
I know we can't trust what they